Health anxiety or hypochondria has been a prominent part of most of my adult life. I have more or less overcome it, but today we're going to look at the symptoms of hypochondria, possible causes for people having this disorder, as well as talking about my own causes, and then we move on how to deal with it. And finally, we'll address if health anxiety is in fact the worst anxiety disorder out there. By definition, hypochondria is an abnormal and chronic form of anxiety about one's health. Now, it is normal for people to worry about their health, of course, but people who experience hypochondria get extremely worried that they're actually seriously ill or are going to be ill in the future. But here's the crucial part. Take note of the keyword here, abnormal, or as I like to think, irrational. And just to demonstrate how irrational this disorder can get, when I was about 14 years old, I was 100% absolutely convinced that I had smallpox. Let's just reflect on that a second. An infectious disease that has been more or less eradicated from society since 1980. It sounds very silly, I know, but you have to understand the mentality and mindset this disorder can actually create within the person. They absolutely believe they are seriously ill. I like to explain it like this. Imagine and visualize and feel your worst fear. Maybe it's being scared of flying or perhaps simply spiders. Having health anxiety disorder is like you being exposed to that fear, fully blown every single day, all day. And that's the biggest issue with health anxiety disorder. You cannot escape it because it's always there in your mind wherever you go. Unlike social anxiety where you can hide away somewhere, with hypochondria, you literally cannot escape it. But here are some common symptoms that are correlated with hypochondria that you might want to keep in mind. But also, to be diagnosed with this, you do not need to have all of these symptoms. The causes of hypochondria are actually numerous and can range from things such as genetic disposition towards anxiety disorders, to things such as learned behavior where someone has received attention or reassurance when displaying physical symptoms in the past. However, there is another cause that I personally can attribute to my experience with this anxiety disorder, and that is trauma. Without going too much into this, when I was around 7 years old, my parents broke up and separated. My dad ended up leaving, and as a young boy, it really seemed to hit me quite hard. Harder than it would on most people. Some years later, when I was around 12, I overheard my mother talking on the phone to a friend. She said that she had found a lump and she had to go and get a biopsy with a doctor. After overhearing this as a young boy, I think this is when I feared that my other remaining parent would disappear from my life, but this time because of cancer. And so from there onwards, cancer and ill health were hardwired into my brain as being a huge threat. Over the years, this manifested itself more and more into an irrational fear or hypochondria. As one of the symptoms stated earlier, when I suffered with hypochondria, I would have a preoccupation with checking my body for abnormalities. I'd check my skin for moles that looked irregular, or I'd be worried about finding a lump somewhere. And this is something normal to do, that is, until you do it every single day and the thought of it never leaves your mind. Then it becomes abnormal. But when a person with hypochondria does find something potentially wrong with them, or at least I can speak from my own experience, you are then filled with the worst sense of dread imaginable. Your world begins to collapse around you as your mind runs off into crazy thought patterns, leading you to believing you are in fact dying of a disease that you've just discovered. Again, it might sound silly, but to that person who has this disorder, in their mind, they are literally dying. The constant fear over the years did lead me to self-medicate with drugs and alcohol throughout my teens and 20s, and at one point, I did actually want to end my life because of it. Yes, it sounds dark and it sounds twisted, and it can sometimes get like this with this disorder. But how can we overcome and deal with hypochondria? In my honest opinion, pills and medications should never be used long term. That's because they tend to only mask the problem. However, SSRIs are more beneficial than, say, benzodiazepines, which literally just dull the mind. You need to tackle this disorder head on, and, if need be, with professional help. CBT, or cognitive behavioral therapy, is a tried and tested method. CBT is often considered the first-line treatment for this disorder. It helps individuals identify and change negative thought patterns and behaviors related to their health anxiety. In CBT, individuals learn to challenge irrational health beliefs and develop healthier coping strategies. Essentially, this is a rewiring of the brain and thought patterns, also known as brain plasticity, hence the name of this channel. And by the way, if you do want to overcome your health anxiety and grow as a person on this journey, subscribe to this channel for more content just like today's video. But I also find that meditation helps with this as well, and that's because in meditation, you observe the brain and how the mind functions. You realize these thoughts are irrational, and you learn not to fuel them with irrational worry and energy. There is also something called ERP. This is a specialized form of CBT that focuses on gradually exposing individuals to their fear, health-related situations, and sensations while discouraging the compulsive behaviors and avoidance associated with this disorder. Alongside this, there are therapy sessions a patient can undergo, as well as education on the matter. But overcoming this disorder involves the patient actively taking charge and taking the steps needed to build a stronger and more rational mindset. For me, understanding the cause and root of hypochondria wasn't really that important. The crucial thing is to understand how the brain and the mind function and to build a new positive thought pattern from there. I personally would say that hypochondria, for me at least, is the worst anxiety-related disorder. But of course, it is all relative, I guess. But if you're currently suffering with this disorder or another similar mental health issue, please do consider reaching out to a professional, especially if you have a very chronic situation. But also make sure to remain hopeful and positive, because I've actually managed to rebuild my life, and that means you can too. You're not alone in this, and you can do it. You might also want to check out my video on the gut and its role in anxiety-related issues. But until next time, aim for plasticity. Peace.